All right, you're watching TVC Breakfast. Now, floods have become a common disaster around the world, but Nigeria seems to be experiencing its worst in over a decade. The federal government on Sunday said that the floods ravaging most parts of the country have far claimed 603 lives and displaced more than 1.3 million people. According to the World Health Organization, the most severe health risk associated with flooding is the contamination of water sources, leading to an increased risk of infection of waterborne diseases through direct contact or the ingestion of polluted waters. For many affected low-income families, they have resulted to staying in these houses despite the risk involved. And that's the crux of our discussion. Now, joining us now is the CEO, Midway Health Limited and Public Health Consultant, Dr. Tuyi Mebawondu. It's nice to have you, Dr.
Thank you, Mike.
Some time. It's been some time now. You're welcome.
Thank you.
Now, I know you've been following this flood situation. We've discussed this issue several times, but it's good to put things in perspective and see from the health challenge perspective. Now, I want you to paint a picture, break it down for us. What dangers are we in with these floods that have swallowed up some houses, cars, businesses, and even human beings?
Let me create some background. As at February, the Nigerian Meteorological Agency, through the seasonal climate prediction, told us that we're going to face this problem. This is the rain level, this is the flooding system, this is the flooding that's going to happen, especially across the banks of those rivers. That was made clear to us. And behold, this year, the rain kept increasing, climate change came, dam got open in Lagdo, in Cameroon. And then we now have as much as 2.5 million people displaced. We have more than 700 deaths. And as much as 84,000 households, are underwater across 33 states. And even the families are suffering in different, states. But what is actually the problem? Why are we experiencing this? There are multiple issues as far as flood is concerned. There are a lot of issues, social issues, infrastructural issues, environmental issues, and there are also health issues. Maybe when we discuss response, then we'll look at how those issues fit together. But specifically, when you're looking at the health challenges from flooding, first and foremost, flooding will take away the hospital, will take away the health center, will drive the workers away. You are going to have problems from that point. Okay, drowning is very common during flooding. You send out reptiles that can bite people easily. But the key issue is the challenge of water supply and sanitation. The water supply and sanitation and infrastructure. The water supply and water is so key to so many things that flood, you see a lot of water, none, is actually useful. Now, what happened is a lot of dirt, a lot of jams, underground, inside the bush, now is washed on the surfaces and then have to actually interact with human beings. First, the wash diseases, diarrhea, cholera, schistosomia, all those diseases are just there. The incidence is increased during this flooding. And people cannot then access health services. A lot of disease-bearing agents, what we call the vectors of diseases like mosquitoes, rodents, all of them actually come out more. They have more contact with human beings and can easily transfer diseases like leptospirosis, chlorispodosis, and all those things to humans. So these are just some of the things that come up. And then no water to drink, increasing skin infections, increasing eye infections, all these things put together to put pressure on the health system that is precarious. Don't forget, one of the key outcomes of the flood is the fact that the food supply is compromised. And before we got to this flood season, we've had challenges with nutrition. We are malnourished, we are high in malaria, we have a lot of negative indices. The hospitals are not working, doctors are running away, and then now flood is now washing away what is remaining in the health system. So these are exactly the challenges we're facing.
You have printed a very disturbing picture of what is going on. Now, you said let me put them in perspective. One, there is institutional paralysis. No hospitals, no doctors. Even the doctors are running for their lives. Even the nurses are running for their lives. Even some of them might be drowned. That's one, institutional knockout. Two, there is nature chaos, which you said, there's water going everywhere. Then you have whether it's rodents, whether it's crocodile, whether it's rat, whether it's snake. All of them, they are all where they are not supposed to be. They have been dislodged from their habitats. So we have nature chaos, which itself is a danger to health and civilization. The third one is the unleashing of all the bacteria and viruses that have been taken away from human contact. So we have all of that going. All of that unleashed. And you mentioned some of them: diarrhea, of course, mosquitoes will now reign, and you have malaria, you have typhoid,
dengue fever,
you have
dengue fever,
cholera, Lassa fever, all those things. And you have all of them. Now, how does a government now say, okay, how do we attack this? First, you don't have the institutions to do it. Which way you start with? You don't have the doctors to rally. So, is it that the flood has now knocked out capacity?
As at February, when the prediction was being made, that was the time to prepare. Let's get it. We travel with data, we play with data. When the data came and said that we're likely going to have flood in this number of states and that was the time to prepare. We call it integrated flood management, in which it's a multi-sectoral. Health is there, infrastructure is there, education is there, water supply is there. It's a multifactorial thing. All of us ought to have cooperated and look at that. Should this thing happen, what do we do next? And then, in fact, the critical thing a government should actually do, first, the cheapest thing is information. Okay? You go right to the community, and then you prepare. Flood response preparedness is critical for us to actually mitigate the negative effect of flooding. So that was not there. It's not just about NEMA or about humanitarian disaster management, because there are complex aspects. The health aspect of it is just what I'm discussing. Where the road is broken, okay, people are not having places to stay, IDP will increase. That will bring another set of challenges as it is. So what a government needs to do is actually to step in. I was expecting in one of these communications of the presidential candidates for them to spare a thought for those people experiencing 2.5 million people, as much as, so even in Bayelsa alone, Sagbama, Ogbejo, Southern Ijo, Ogbia, all of them, Okoruma, all of those places flooded completely, including, the Yenagoa itself. So I expected someone to spare a thought for them. I said, listen, gentlemen, we understand, we have to figure out. And then, critically, a government, before the flood comes, a government should be able to look at the pathways of the flood and ensure that the water has a way to flow, because, Anthropocene activities is actually affecting the water level and the flooding of the country. Of course, our health system may not be that prepared, but the basic thing that can be done is still be at the primary health care centers, which you will find in all of these locations. I mean, there must be a preparation in such a way that should flood take this place, of course, we must be able to measure and assess that before the flood comes, and then, pull the health system a bit upward, and create response for people, either as an emergency, whether on the boat or, or after the flood, because after the abatement of the flood, you see how a lot of health issues you are going to face. So a government starts from educating, they start from clearing the pathway for the water, they start by preparing for emergency response and engaging the people continually as they go through this. Of course, government must provide intervention. You cannot allow people to or the whole place to get flooded, and then what you are looking at that people, they've lost their material, they've lost their, of course, 84,000 hectares of farmland lost. So they've lost all those things. You must prepare. Malnutrition will worsen. Disease will increase. They will lose money. You have to actually be able to hand out some benefits to them to help them restart their lives.
I have to break down for some of these diseases.
Yeah. Let's go on a break. When we come back, we'll dissect, the details of some of the diseases that people can be, exposed to, the risk of it, and then how to prevent it as the case may be, or maybe maintain it or manage it as the case may be.